For the next drug I'll be discussing, this is what is known as the Zanamivir. So pharmacology of Zanamivir. So you can see that Zanamivir has a very popular brand name that some people used to even forget that this drug is called Zanamivir. So the brand name is known as Relenza. Okay, that's the most popular brand name for this, So it's an antiviral drug. It's mainly used in treating what? Influenza A and influenza B virus. Okay, so it's a Neuraminidase inhibitor. Okay, that's a class of Zanamivir. So it inhibits an enzyme known as the Neuraminidase. This enzyme is mostly found in influenza virus. Okay, the enzyme, right? What's the role of this enzyme? When the influenza virus makes other copies of itself, is the enzyme that will now facilitate that, okay, this copy is right, let's release it into the system. Do you understand? So it's the neuraminidase that makes the infection to be spreading from one place to another. So if you inhibit the enzyme, it will stop the release of those newly formed viruses into the system. So you have the virus making copies of itself, but the virus is not able to release those copies. So this drug basically what keeps the virus in one place and stops the spread of infection. Do you understand? So administration is usually inhaled. Alright, usually inhaled. So influenza virus affects the respiratory tract. So I will inhale it so that it will function in the respiratory tract. I get in it. No need to put the drug into the whole system. It's just a particular system that is affected. I can reach this system via the nose. So I'll make the drug in a form that the person can just inhale. That's how pharmacology is. So absorption, it just goes into the lungs, so rarely does it go into the system. Okay, half-life is about 2.5 to 5 hours. So therapeutic use used in treating uncomplicated influenza infections in patients. Once the patient is above 7 years, you can use this drug for them. Just like I told you guys, most antiviral drugs are just particular disease conditions. So this one is just influenza, So adverse effect is cough, can cause throat discomfort, can also cause headaches.